Hello, my name is Ed Noseworthy, and welcome to Florida Hospital Fish Memorial. As President and CEO of Florida Hospital Fish Memorial, and on behalf of our physicians, employees, and volunteers, I want to thank you for trusting us with your healthcare needs. I am grateful to work with such a caring team of individuals. Their goals and mine is to provide exceptional care every patient, every time. The Healthy 100 program series shares ideas to help you embrace healthy choices throughout your life. We hope you enjoy the program and wish you a quick and complete recovery.
Hello, I'm Tracy McCoy. Welcome to A Healthy 100, where we help you become proactive in living a healthy, active, and productive 100 years. Today we're going to talk about women's health. We'll talk about some of the more common concerns for women, including pregnancy and birth control, pap smears and hormone therapy, as well as some other tests and conditions specific to women. We are very pleased to have Dr. Malika George with us today. Dr. George is board certified in internal medicine. She received her medical degree from the University of South Florida College of Medicine and completed her residency at Orlando Health. Welcome to the show, Dr. George.
Thank you.
Thank you for joining us. Just to start off our discussion today of women's health, let's just talk about some of the more obvious issues such as pregnancy and birth control. Do you think that a woman's choice of having children affects her overall health throughout her life?
Yes, it does. For example, women who tend to have kids at an older age or who have no kids at all tend to have an increased risk of developing ovarian cancer. So sometimes it's better to have more kids at a younger age because that decreases your chances of having ovarian cancer.
Are there some health issues and conditions with pregnancy?
Yes, there is. For example, there's something called gestational diabetes and gestational hypertension that develop during pregnancy. This is basically gestational diabetes is when your blood sugar is too high, and gestational hypertension is when your blood pressure is too high. And in talking about hypertension, there's different types of syndromes that can occur if you have hypertension during pregnancy, such as pre-eclampsia, and that can actually occur even if they didn't have any high blood pressure at all from the first or second trimester. It can occur towards the end as well. And basically they develop high blood pressure and the kidneys start spilling proteins into their urine. And another extension to that is something called eclampsia, where they have the high blood pressure and the protein in the urine, as well as seizures. And the pre-eclampsia and eclampsia, usually they're treated very quickly by delivering the baby.
So then how old is too old to get pregnant?
Right now, it doesn't seem that there is any age limit on getting pregnant because of all the advances in fertility treatments, such as IVF and egg donation. However, as women get older, they tend to develop hypertension and diabetes, which can cause complications with pregnancy, and sometimes that can lead to premature birth as well as stillbirth. And on a whole, the older you get pregnant, even if you do not need fertility treatment, your eggs get older, and that can increase your chances of developing babies that have Down syndrome or even ectopic pregnancies.
What about the pill? Are there risks to taking the pill?
Yes, there is. The pill increases your risk of getting blood clots, heart problems, and stroke. Therefore, any woman who is over the age of 35 who smokes should not be on birth control pill. Anybody who has a risk of stroke, such as women with diabetes that have complications with their eyes and their kidneys and their brain, should not be on birth control pills. And also in regards to stroke, people who have migraine with aura have an increased chance of getting stroke, so they should not be on the birth control pill. And by migraine with aura, I mean migraines that come about associated with neurological symptoms. Like right before they get a headache, some women will get numbness and tingling, and some they lose their vision. All this are sign of a migraine aura, and they should not be on birth control pills.
Okay. Another health concern, specifically to women, is of course ovarian cancer. Do you think that all women should be screened for ovarian cancer?
This time, it's not recommended that average women get screened for ovarian cancer. It's only high-risk women should be screened for ovarian cancer. By high-risk women, I believe is women who have any type of breast ovarian type syndrome, such as the BRCA1, BRCA2 mutation. That's a gene mutation. They have an increased chance of getting breast and ovarian cancer. And usually, it's recommended that they get what we call prophylactic oophorectomy. And by that I mean where they have their ovaries actually taken out because of such an increased risk of getting ovarian cancer. So these are the women that need to be screened for ovarian cancer.
Some of those tests you mentioned, I didn't hear you say pap smear, and that's what I thought the test was. What exactly is a pap smear then?
Pap smear is different. It actually screens for cervical cancer. And cervical cancer is caused by a virus called HPV. And basically the test is a pelvic exam where the doctor takes a sample of the cervix, and the sample is looked under a microscope, and they look for any type of atypical cells, which might suggest precancer or cancers of the cervix.
And when should a woman start to get the pap smear?
They should start getting a pap smear. Now the new recommendation suggests at 21 years of age, whether or not they had had sexual intercourse 1 year or 2 years or 3 years ago, and it should be done every 2 years for women over the age of 30, and every 3 years for women over the age of 30 with HPV testing done as well at the same time.
So then is it safe at some point to stop getting that test?
It is safe if you're age 65 to 70 and you've had 3 negative consecutive pap smear results.
Okay. And is a pap smear still necessary if you've had a hysterectomy?
Well, it depends on what type of hysterectomy you had. If you had a total hysterectomy where they removed the cervix and they did that because of benign conditions, then you do not need a pap smear anymore. If, however, that the total hysterectomy was done because you had a precancerous lesion or cancerous condition associated with the cervix, then you still need to have a pap smear.
Recently, there's been a lot of talk of hormonal replacement therapy, as well as how some conditions show up differently in women. So who benefits from the hormonal replacement therapy?
Hormonal replacement therapy, especially estrogen replacement, is very beneficial for women undergoing the symptoms of menopause. That is the hot flashes, the vaginal itching and dryness, and what we call the atrophy, where the walls of the vagina gets thinner because of the lack of hormones. These are the women that have been targeted to benefit the most from hormone replacement therapy, and it should be usually the treatment should last 6 months to like 5 years, but some women may benefit from it longer. It depends on the symptoms that they're having. Also, hormonal replacement therapy is very beneficial in osteoporosis prevention and treatment, but it's not a first-line therapy anymore. It's a second-line if the other more common osteoporotic medications cannot be used.
So are there some women who should absolutely not have HRT?
Yes, anyone who has a risk of stroke, heart disease, or any type of like cancer, like breast cancer, endometrial cancer, should not be on hormone replacement therapy, as well as anyone who doesn't need it, like anybody who's way past menopause and their symptoms have resolved.
What about high blood pressure? Does that present differently in women?
High blood pressure does not necessarily present differently symptom-wise in women, because universally, although high blood pressure is very common, most people have no symptoms. There's no symptoms. They may complain of sometimes, oh, I feel like I have a headache, or my chest hurts when I feel my blood pressure going high, but it's usually asymptomatic. However, men tend to develop blood pressure younger than women. Women tend to develop high blood pressure after menopause.
Now, what about heart disease? Does that present differently in women than in men?
Yes, it does. First of all, heart disease is the most common cause of death and disability in the United States, and that's because it's a very silent killer. Usually, heart disease, there's no symptoms. Um, However, when it comes to heart attack, women tend to present differently. For instance, most men present with chest pain, with exhaustion, which is the most common complaints.
Yeah.
However, women, they complain about chest pain that's caused by stress. They may complain of neck pain or even back pain, and that might be a clue of heart disease, but it's not often thought of.
Yeah, that's good to know, because I think that neck pain and back pain, I would just slough it off, as that's what I feel every day when I'm schlepping everybody around. I probably wouldn't do much about it, but I guess, osteoporosis is very common with women as well, and where you would have some of those bone pains and that sort of thing. What is the DEXA scan, and who should maybe have that?
The DEXA scan is basically like a bone scan that look at the density of your bone to see if you have any risk of developing osteoporosis and osteopenia. And women who should have it is anyone, according to the United States Preventive Services Task Force, anyone 65 years and older should get a DEXA scan. Also, women who have risk factors of osteoporosis, such as those who smoke, those who are very thin, and those who have any type of adult fracture, especially hip fractures, should be screened for osteoporosis. And anyone who's also taking steroid therapy should get a DEXA scan.
Okay. Well, one of our goals here on A Healthy 100 is to empower people to become proactive in their health, their overall health, and their longevity plan. So if a woman is pretty healthy, does she really need to go to the doctor?
Yes. Doctors not only treat diseases, but also they prevent them from happening. So therefore, it's always a good idea that even if you think you're healthy, that you should be screened for most common diseases that do not even present with any symptoms, such as diabetes, cholesterol problems, high blood pressure. It's a very good idea for everybody to go in and check in with their doctor once in a while to be screened for these diseases, as well as to make sure that they're up to date with their immunizations. Also, they should also check in with their doctor to evaluate their risk of certain cancers and to make sure that they're screened at the appropriate time.
Now, what about if a woman's not overweight? Should she still exercise?
I know there's a misconception that just because you're skinny, you don't need to go to the gym or you don't need to work out. But exercise does more than induce weight loss. It's good for your overall health. It reduces stress. It helps decrease cholesterol, if you have any type of cholesterol problems, or prevent it from happening. It helps to decrease your blood pressure if you have high blood pressure, or it can prevent you from developing high blood pressure. So therefore, overall, just keep having an active lifestyle will help you keep you healthy.
And what would you suggest as an exercise and diet plan?
Well, I believe that the best way to induce weight loss or to maintain your weight, a healthy weight, is through diet, exercise, and behavioral modification. With that, there are many diets out there. The most common ones are the low-fat diet or the low-carb diet, or what they call the balance, where they have a balanced amount of the fats, proteins, and the carbs. But the overall goal is to decrease your calorie intake, and that's what is going to cause weight loss. And basically, none of them are superior to each other in the overall weight loss sense. However, the reason why most diets fail is because people fall off the wagon, so to speak, and they gain back the weight. And the way to keep the weight loss is through behavioral modification. For example, logging what you eat, monitoring your calorie intakes, also join a support group either online or in the community, and also always make sure you implement exercise. Everyone should at least have 20 to 30 minutes of exercise on most days of the week, exercise 7 times daily. And I think that everyone who has never exercised before and don't like exercise, they should start being active, and they should always start slow, 10 minutes a day, for instance, and then work your way up until you get comfortable. And always do something that you love, because you'll stick to it better.
What about vitamin supplements? Do you think every woman should be taking vitamins?
Some people believe that, for example, folate acid should be taken by every woman, but it should be taken for anyone who thinks that they want to be pregnant in the future, not necessarily next year or next month, but if you think that you want to become pregnant, it's always a good idea to take a folic acid supplement. And when you get pregnant, you are required or expected to increase your folic intake, and most women end up going on a folic acid supplement when they're pregnant. Other supplements like calcium, you can get in the diet, and if you're sure that you're taking in a lot of calcium or the right amount of calcium for your age in your diet, then it doesn't necessarily mean that you need to take a supplement, but sometimes you may need to, because when you're older than 50, you need 1,200 milligrams, and it's hard to get that through the diet. And when you're less than 50, as an adult, you require about 1,000 milligrams. So sometimes it's beneficial to take a supplement. Of course, you don't want to overdo it, because there's a lot of risk in taking something too much.
Well, finally, what is your advice to the really busy woman who just struggles to stay healthy?
I completely understand, being a mother and a caretaker. I mean, I have to work as well as take care of my family. It's hard to put exercise or to eat healthy because you're so busy, and it's easier to just get something that's very fast to eat.
Exactly.
And sometimes it's hard to go to the gym. My advice is, in order for you to take care of your family, you gotta take care of yourself. So I know a lot of women, they tend to make sure that their kids go to all their well visits, but they also neglect their own well visits.
Yes, that's great advice.
Yeah, so it's always time you should make the time to take care of your family, in order that you should make time to take care of your family as well as yourself, in order that everybody could grow together. So you could start like eating healthy together, implementing exercise together as well, and also make sure that you make time to check in with your doctor.
That's great advice. Thank you so much for joining us and helping us understand a little bit better some of the issues that women face specifically. But before we let you go, it's our tradition here to ask the doctors what their secret to longevity is. In other words, what do you do personally to live a healthy 100?
Well, I do try to watch what I eat. I believe in a balanced approach. Like, it's okay to have something like sweet once in a while, but also to say no and to eat in moderation. I also try to stay active, and for instance, I hate personally to go to the gym, so I find other ways to get a workout. And for instance, I like doing Zumba. Zumba is one of the ways that I get to work out and have fun at the same time.
Yes, I saw you in one of your Zumba classes. It looked like you were having a great time.
Thank you.
Looked like a lot of fun. Yeah, I think I might. Well, thank you again for joining us.
Thank you for having me.
For more information on Dr. George, log on to fhfishmemorial.org.
It was just another Wednesday. Or is it Thursday? It was definitely a rainy day. It was coming down hard. I could barely hear my monologue over the rain. Can we turn it down a bit? The storm seemed to be passing, and just in time to hear the knock at the door. Come in! It was Miss Broccoli. Broccoli belonged to the cabbage family. This bunch of vegetables are notorious around the dinner table. She had green hair and was kind of stocky, but she meant business. You have to help me, Buzz Brockman. You are the only one. I'm the only one who can help, eh? No, you're the only one who called me back. Ah, well, you have a good point, Broccoli, but I don't see how I can help. You must tell everyone that I am not so bad. In fact, I satisfy the daily requirement for fruit and vegetable intake. Well, that's good, but if you want to clear your reputation around here, people need to know what you can do for them, Well, I'm rich. Pfft, don't rub it in. We're in a recession, you know. I can't even afford to do this episode in color. No. I am rich in vitamin C. In fact, one serving of broccoli helps ease discomfort of the common cold. Not to mention, I assist in maintaining optimal brain function on the healthy nervous system, and I regulate blood pressure, and I have vitamins for the healthy bones, and Well, if that's all, then... No! There is more! I have glucorophenin. Sorry, I don't speak German? Neither do I. I contain glucorophenin, which helps the skin to detoxify and repair itself from damage, like a sunburn. Wow, that is helpful. You know, Broccoli, I think people will see why you should be an essential part of their daily diet. You think so? Oh, thank you, Mr. Brockman, thank you. You know, Broccoli, I think this is the beginning of a beautiful friendship. Here's looking at you, kid. What do you mean looking at me? You've been looking at me the whole time. I don't know, it's something they say in these situations. All right, see you later. Okay, bye. And just like the sound effect rain, she was gone.
We're back with our Healthy 100 correspondent, Joanna Yackel.
Thanks, Tracy. I'm glad to be here.
You know, I was just speaking with Dr. George, and after talking about all of these health issues concerning women, I really think that most women just think there's just not enough time. You know what I mean? There's not enough time in the day to do everything that you need to do.
I know I certainly feel that way sometimes, you know. The last thing you want to do after a busy day is go home and cook and clean.
Yes, and my challenge is exercise. I mean, I love to dance. I used to dance all the time, but, you know, I kind of talked myself out of doing it, and once you get out of the routine, it's kind of hard to get back into the routine.
I think we all feel that way sometimes. You know, it's recommended to get at least 30 minutes of exercise every day, but it's also important to remember that any exercise that you're getting is going to be beneficial, not to get too stressed out about adding another thing to your to-do list.
Yes, but you know, when I am exercising, I do feel a lot better. I mean, I notice that I have more energy, I don't get as hungry during the day, and I even sleep better at night.
Yeah, exercise can definitely make us feel better in so many different ways, and we really all owe that to ourselves. Florida Hospital recently introduced a new campaign called Change Your Life, challenging community members to take more personal steps to live healthier lives. I think what you need is a new routine that's going to reinvigorate your love of dance and give you that exercise that you've been missing. And I think I have the perfect thing, Zumba.
Zumba, I've heard of that, and I thought that might be fun. Ooh, sounds like the perfect change your life challenge.
Yeah, Zumba combines Latin music with high-energy dance style moves that really get your heart pumping. The goal of Zumba is kind of to let the music move you rather than counting your steps like a traditional aerobics class.
Ooh, that sounds fun.
Yeah, the best way to get an idea of what a class is like is to just see one for yourself. So let's take a look. With Florida Hospital Change Your Life campaign, and I'm here with Eva Ruiz, our Zumba instructor for the day. So Eva, for those of us who don't know, what is Zumba?
Zumba is a combination of dance and fitness. You dance to different kinds of music. We're dancing to salsa, merengue, cumbia. We add a little bit of hip hop, Bollywood, all kinds of international music. You dance for an hour, you get a workout, you're working your abdominals, your legs. You're getting a good workout. By the time the hour is up, you don't even realize you worked out your whole entire body.
Well, it sounds like a really great way to get some exercise. So when did you first get into Zumba?
I started back in '09, and I've always been into dance. I've always been into fitness. I took my first class back in '09, and after my first class, I was like, this is what I need to be doing. This is definitely something for me and something that I like to do, so I like to share it with others as well.
And what's your favorite part about it?
My favorite part about Zumba itself is not only you get a great workout and it's fun and exciting, but just the Zumba community itself is huge, and everyone's like a big family. So wherever you go, whether it's a Zumba event or a party, just the community feel and the family feel is just great. It's a great time.
Well, it sounds like a lot of fun. Thanks so much, Eva.
Thank you.
Thanks, Joanna. That looked like a lot of fun. And I think you're right. A new routine is just what I need to get exercising again.
Well, thank you so much for having me.
Well, that's all the time we have for today. Thanks for joining us here at A Healthy 100. On behalf of Florida Hospital Fish Memorial, we hope that you accept our challenge and become proactive in living a healthy, active, and productive 100 years. I'm Tracy McCoy. What are you going to do when you're 100?